Hello students, myself Dr. Komal, Assistant Professor, Department of Komal, Faculty of Ayurvedic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur, Rajasthan. Students, today's topic is about Turner syndrome. In this series, genetic disorders. Firstly, we will discuss about Down syndrome, and then we will talk about Turner syndrome. So, start with this introduction. So, Turner syndrome is, first of all, Turner syndrome. Turner syndrome overview. What is Turner syndrome? So, Turner syndrome is a chromosomal condition that is describes girls and women's with the common features that are caused by complete or partial absence of the second sex chromosome. टर्नर सिंड्रोम एक क्रोमोसोमल कंडीशन है जो कि बेसिकली फीमेल क्रोमोसोम में पाई जाती है, जिसमें कि जो हमारी बॉडी के अंदर सेक्स क्रोमोसोम होते हैं उसका एक का कंप्लीटली या पार्शियली लॉस हो जाता है, वो उसमें प्रेजेंट ही नहीं होता. So the missing genetic material affect the development before or after birth. So Turner syndrome occurs in approximate one of every 2000 or 2500 live female birth, or approximate 10% of all miscarriages. So what is the cause? What is the cause of Turner syndrome? Normally, a girl inherits one X chromosome from her mother and one X chromosome from her father. But girls who have Turner syndrome are missing one of their X chromosomes. So here is Turner syndrome. It's typically caused by what is called not disjunction or absence of one sex chromosome. So non-disjunctions happens when a pair of sex chromosomes fail to separate during the formation of a sperm or egg. But it is talk about only female child. So here is the absence of one X chromosome. When X chromosome when sperm with no X chromosome unite with the normal egg to form an embryo, that embryo will have just one X chromosome rather than XX or XY. So as the embryo grow and cells divide, the X chromosome will missing from every cell of the baby's body. We were talked about in Down syndrome. There is only trisomy of chromosome number 21. So where there is in Down syndrome, the somatic chromosomes present extra with 21 chromosomes. So in Down syndrome, trisomy of chromosome लाइट जाने से हो जाता है, लाइट जाने से हो जाता है. And sperm with no X chromosome unite with the normal egg to form an embryo. The embryo will just have only one X chromosome. So as the embryo grows and the cell divides, the X chromosome will be missing from every cell of the baby's body. So researcher has have determined which gene of on the X chromosome are associated with most of the feature of Turner syndrome. They have, however, identified one gene called SHOX that is important for bone development and growth. So the loss of one copy of gene likely cause short stature and skeletal abnormality in women with Turner syndrome. So it is important loss of one copy. And in Down syndrome, there is trisomy of chromosome number 21. So is the one extra copy present, and here is the loss of one copy of one sex chromosome. In this figure, Turner syndrome's babies pick are there. So here is 45 X chromosome, monosomy of X chromosome. That is called Turner syndrome or Ulrich Turner syndrome. Types of Turner syndrome is X chromosome monosomy, X chromosome mosaicism, or X chromosomy defect. So X chromosome monosomy is about 50% of 50% of individuals with Turner syndrome have monosomy of X chromosome, which means each cell in the individual's body has only one copy of X chromosome instead of usual two sex chromosomes. So the duration, the process in which oocytes or sperm are formed. One of sex chromosome is sometimes lost. An embryo receiving only Y chromosome can not survive, but the embryo receiving only X chromosome may survive. So development as female with Turner syndrome. So 45X naught is known as classical Turner syndrome. X chromosome mosaicism is the second type of Turner syndrome. So about 30% of girls with disorders are missing the X chromosome in just some of their cells. This mixed chromosome pattern is known as Turner syndrome mosaic. In this form, only X chromosome just found in some their cells. So here is the only pattern called 46XX or 45X naught. So girls with this pattern may have few symptoms because they still have some normal cells. So X chromosome defect. Third form is X chromosome defect. In about 20% of Turner syndrome cases, both X chromosomes are present, but one is abnormal. So it may be shaped like a ring or missing, or some genetic materials may be there. So this is all three types of Turner syndrome. Now, combinedly, we discuss about its symptoms of Turner syndrome. So the term is syndrome is used to describe a collection or combinations of system uh, which result from a single causes. It does not necessarily means that all are present in the person who has the syndrome. Girls with Turner syndrome may have only few or several of features associated with Turner syndrome, like short stature or infertility, are near always present. But Turner syndromes affects growth and sexual development. The most common feature of Turner syndrome is important feature is short statures. So short statures is the most common feature of Turner syndrome. So Turner syndrome becomes evident by the age of 5. Girls who have Turner syndromes are shorter than average. They often have normal height for the first 5 years of life, but then have a slow progression rate. At puberty, they do not have the usual growth spurt. Non-functional ovaries is also found in Turner syndrome's females. Normally, a girl's ovary begin to produce sex hormones like estrogen and progesterone at puberty. This does not happening in most of girls who have Turner syndrome. So Turner syndrome females does not produce sex hormone estrogen and progesterone. So they have infertility. However, most girls with Turner syndrome will not produce sex hormone, which means other girls they may not start their monthly period naturally. So they may not fulfill develop breast and they may be infertile. And the third point, it is important symptoms like intelligence. So most girl and women with Turner syndromes are usually of a normal intelligence with good with good verbal skill and reading skill. But some girls who however have problem with math, memory skill, and fine finger movement in this Turner syndrome cases. So other symptoms of Turner syndrome is about 30% of female with Turner syndromes has extra fold of skin in the neck that's called webbed neck, a low hairline at the back of the neck, a broad chest, and wide spaced nipple, or puffiness or swelling in lymph nodes of the hands and feet, shown in the figure, and small narrowing fingernails, toenails that turn up. Skeleton abnormalities may be there, and kidney problem is also may be there. Then osteoporosis can develop because of lack of estrogen. Arms that turn out slightly at the elbow. Diagnosis of Turner syndrome. So, how can we diagnose the Turner syndrome? So, it is important before the baby is born. Turner syndrome may be diagnosed during pregnancy with chronic villus sampling, that's called CVS, or amniocentesis. Alternatively, an ultrasound, a machine that uses sound waves to look inside the mother uterus, can identify the disorder by its physical symptoms. So, about half of the cases are diagnosed within the few months of girl's life by characteristic symptoms, swelling of hands, feet, and heart disorders like. Now come to the treatment. So, treatment of Turner syndrome, the best way to treat this disorders is hormone replacement therapy. Hormone replacement therapy is usually started at the time of normal puberty. It's around age of 12. Teenagers are treated with growth hormone to help them reach a normal height. They may be gives low dose of androgen. Male hormone for female also produce a small quantity to increase height and encourage hair and muscle growth. And some patients have take the female hormone estrogen to promote sexual development. Now, baby born with heart murmur or narrowing of aorta may need surgery to correct the problem. Blood pressure should be checked routinely and, if necessary, treated with medications. Almost all women are all women are infertile, but pregnancy with donor embryo may be possible. And having appropriate medical treatment and supports allow a women with Turner syndrome to lead a normal and healthy and happy life. So, interesting factor about Turner syndrome is that uh, TS affect 60,000 female in US. This disorder seen in one for every 2,000 to 2,500 baby girls, but about 800 cases will diagnosed each every year, or 75 to 80% of cases with single X chromosomes comes from mother eggs and father sperms that fertilize the egg is missing its sex chromosome. So Turner syndrome is named by Dr. Henry Turner, who, who in 1938 published a report describing about this disorder. So the average height of the untreated women with the Turner syndrome is 4 feet to 8 inches. A female fetus, normally XX, that missing one of its X chromosome can survive, but the male fetus, normally XY, cannot. So the X chromosome is a long DNA molecule with many genes. that are needed for cell to function. So it is essential for life. In contrast, the Y chromosome carries few genes and it's not essential for life. So thank you for this session. Hope you understand about Turner syndrome and its type and its diagnosis way and its sign and symptoms. Hope you understand this session. If you have any kind of query, you can ask me in comment below section. I will try to resolve the problem. So thank you. Thank you so much.